Well, good afternoon, everyone, and welcome. So thank you for joining us today to Comcare's Mental Health Community of Practice. My name is Megan Buick, and I'm the General Manager of the Strategic Partnerships and Engagement Group at Comcare, and I will be your host for today's event. I would like to acknowledge the traditional custodians on the lands on which I am presenting today. I'm joining you from my home, which is in Murrumbina, and the traditional name of Murrumbina Place is Boon Wurrung in the Kulin Nations, which is in Melbourne. I would also like to pay respect to their elders past, present and emerging, and to acknowledge the contribution they have made and continue to make to this region. And I extend that respect to other Indigenous Australians and Torres Strait Islander people who are present. Today's event is an opportunity to discuss approaches for creating a thriving workplace and emerging trends in workplace mental health. We will explore findings from SuperFriend's Indicators of a Thriving Workplace survey. And we'd also are delighted to hear about the Department of Foreign Affairs and Trade's systems approach to organisational risk management and discuss strategies to effectively support workplace mental health. There are many of you online today, and we really thank you for taking the time to participate into this event. And we hope the session is enjoyable and provides you with some valuable insights and learnings that you can take back to your workplace. So our first speaker is Associate Professor Ross Iles. Ross is the Chief Research Officer at SuperFriend. Prior to joining SuperFriend, Ross's research focused on the prevention of unnecessary work disability. Now his focus is moving on from raising awareness and reducing stigma to providing actionable insights and shifting the dial when it comes to workplace mental health. Ross's approach to research focuses on developing partnerships to understand the problems and to identify solutions that fit best with the demands of stakeholders. Please welcome Ross.
So I'm excited and I'm very proud to be presenting today. This is my first opportunity to represent SuperFriend. And for those who aren't familiar with SuperFriend, we are an industry super fund mental health initiative, and we exist to help people thrive at work, both today and tomorrow. So what I'll be presenting today is the very first look at some of the data we've collected in our 2022 iteration of the Indicators of a Thriving Workplace survey. Now it's the very first look, so some of the kinks might not have been worked out in terms of the things like the text size on some of the figures and that sort of thing. So just apologies in advance, but we'll keep working on that so things are as clear as possible. So just to give you an idea of what I'll go through in the next 30 minutes or so, it's an introduction to the 2022 survey and a little bit about how it was different to previous years. I'll take you through our 5 domains that summarise what is really a large amount of information, but summarises it into digestible numbers that provide us with actionable insights into how we can shift the dial in terms of mental health in the workplace. I'll briefly touch on psychosocial hazards. Of course, it's very topical given legislation that's just come into effect across multiple jurisdictions. And in particular, I'll share some of our findings related to the impact of workload and remote work. I'll wind up the presentation with a focus on what workers told us were some of the best things that their workplace had done to improve mental health in the workplace. And also a little bit there in terms of what their ideal workplace might look like in terms of mental health. And I'd just like to point out right now that what I'll cover today is very much the tip of the iceberg in terms of the data that we've collected and the insights that we can gain from the data we've collected so far. So please, if you'd like to know more, please get in touch with SuperFriend and I'll give you some key details towards the end of the presentation. So this is the 8th time we've run the Indicators of a Thriving Workplace survey. Some of you may be familiar with previous versions of the survey, but in 2022, the data is just a little different. Now, in previous years, we've collected information from nearly 10,000 employed people covering 19 different industries, and we've applied the latest information from the Australian Bureau of Statistics. I always struggle saying ABS in full. But what that allows us to do, it allows us to weight the data appropriately to make sure it's truly representative of the Australian working population. But what really makes the 2022 data different is that it's actually the widest survey we've ever conducted. And by that, I mean we collected much more information reflecting the latest research evidence and in particular concepts of interest in relation to mental health in the workplace. So we're really making sure that our data represents what the evidence is telling us about mental health in the workplace. But it also reflects our shift from just raising awareness and reducing stigma, as Megan mentioned before, but really focusing on providing actionable insights into the issue of workplace mental health. So what can we actually do about it? It's clear that we need action. And in 2022, the way we asked our questions reflects that desire to provide Australian employers with directly useful information about what they can do. So in casting the widest net ever, we used over 120 questions about factors influencing workplace mental health. And in order to condense that information into a format that's readily understandable, it's pretty hard to report on more than 100 different questions at once. We used a range of statistical techniques to identify the groups of questions that you can put together and provide a score and summarise how things are tracking in workplaces. Now, we call these groups our 5 domains of a thriving workplace, and you might be familiar with them from past reports. However, with a focus on the actionable insights and the new information we've collected, some of these domains are different to previous years, and I'll dive into each one in a little bit more detail in a moment. But here they are. The first domain is connectedness, which is the same as previous years. However, there are a slightly different set of questions that reflect this domain. But connectedness really refers to the quality of the interpersonal relationships in the workplace. Safety is a new domain, and it's focused really on protection from harassment, bullying, and violence in the workplace. Leadership is similar to previous years and focuses on how managers support positive mental health in the workplace. Work design is a new domain focused on the way that roles, tasks, and responsibilities are organised at work, and we'll go into that in a bit more detail later. The fifth domain here is the capability of the workplace in terms of the skills and resources available to support mental health. While it's similar to previous years, once again, there's a greater focus on putting policies into practice. So really about how does the rubber hit the road when it comes to mental health in the workplace. So these 5 domains are a summary of action areas for workplaces to focus on in terms of mental health. In the same way we have in previous years, we're able to allocate a score out of 100 for each of these domains. And what that score reflects, it reflects on the levels of agreement and disagreement related to the presence or absence of those factors that are known to influence mental health. Each domain, like I said, is scored out of 100, and the closer the score is to 100, the better the mental health or that domain within the workplace. Now, so what we found here across the connectedness domain, across average, almost 10,000 people, the connectedness domain resulted in a score of 78.5. So remember, 100 is the maximum and 0 is the worst it possibly could be. It's worth stopping to point out here that the score for connectedness in 2021 and the score in 2022 is no longer comparing apples with apples. Because we've cast the widest net possible to capture the most up-to-date information, there are different factors feeding into the scores. What we can do, rather than directly comparing scores, is we can look at where the domains land relative to each other. So connectedness scored the highest, followed by safety. Now, the rankings for leadership, work design, and capability illustrate the areas where the most improvement is needed to improve mental health in Australian workplaces. So we have a ranking here from our survey in terms of which factors are performing the best when it comes to workplace mental health. And connectedness and safety sit at the top of that ladder. Leadership, work design, and unfortunately, capability is the area that needs the most work to help people thrive at work. Now, just in case you're eagle-eyed and really familiar with our past reports, you might notice that culture isn't actually called out as one of our domains anymore. And you might be thinking, well, how can you talk about mental health in the workplace and not specifically mention culture? Well, the clearest way to think about that is that workplace culture is actually an umbrella term that covers not just how workers interact with each other, but also how leaders lead, how the work is structured, how safe workers feel at work, and the capability to respond adequately when support is needed. So we see culture actually sits at the center of our domains, and much like the wheel on a car, um, if the overall culture isn't right, the wheel will be flat in a section. You need evenness across the 5 domains for a culture to be healthy. And so, for example, if leadership is lacking, it's like you're driving with a flat tire. And you can drive a car on a flat tire, but there are a number of impacts. It's harder to steer. If you do it for too long, the tire can burst. And there are a range of other significant problems that I don't know anything about because I'm not a mechanic. But in terms of working out how you can improve your culture as a means to improve workplace mental health, we believe our domains provide clear guidance on how to do that. And I'll go through what that is in a moment. But what we're able to do with our 5 domains is effectively give you an average across those scores to provide a single number to describe the state of mental health by industry across Australia. Now, what you see here is a ranking of 19 industries according to this single summary score. And that provides an indication of how each industry is performing relative to other industries. And one thing you might notice that education and healthcare sit at the bottom of this ladder, and that's not necessarily surprising given the recent impacts and how they've disproportionately affected healthcare and education around things like working from home and the impacts of COVID-19. Across all the industries, the national average score was 72.8. So if you haven't already, please take a moment to work out where does your industry sit in this ranking. Are you above or are you below the national average? If you're below, you know there is work to do to address the mental health of workers in your industry. Even if you're above the average, how close to 100 are you, or how far away are you? Sure, at the moment, there's a strong focus on compliance with work health and safety legislation. But what do you need to do beyond just compliance? How much further can you go to help your workers really thrive at work? So let's take a look at each of the 5 domains in a little bit more detail. So connectedness, and we've got the definition that we've used for connectedness there, but it consists of questions that ask about how workers treat and trust fellow co-workers in the workplace. It was the highest rating domain across the survey. And looking at our data, more than half of workers reported a lifetime experience of a mental health condition. And with 28.2%, they experienced a mental health condition in the last 12 months. What I'm showing you here is a summary of the actions that people took regarding their mental health in the past 12 months, ranging from seeking support from family members or friends, all the way to looking to HR for help at work. What we did find is that those that took actions to seek support for their mental health from co-workers actually had a much higher connectedness score of close to 80. What we can also see from this information is the amount of help that is actually sought from within the workplace. Yes, the majority of help was sought outside of work, but within work avenues such as co-workers, accessing the EAP, or seeking support from the manager, there's significant sources of support, and strengthening those pathways of support at work will not only support workers with their mental health, but will also enhance those connections within the workplace that we know are really important, both for mental health, but also for productivity. One of the questions we asked in the survey was for workers to name the best thing their workplace had done to support mental health. Now, we received a range of responses across our nearly 10,000 respondents that described a real spectrum of approaches to workplace mental health. So here are 2 examples of how workers describe what their workplace had done, specifically related to connectedness, if you like. Which of these 2 ends of the spectrum would your workplace reflect? While we'd like to think the second situation, or that dark blue box, exists less and less or happens less often, there are certainly workplaces where this approach is still common. We'd much like to have the situation where all workplaces talk about how their workplace is supportive and that employees and employers are connected and open. The second highest scoring domain was safety, which really focused on harassment, bullying, and discrimination. And in our survey, 1 in 10 people experienced bullying at work in the last 12 months, and the same number, 1 in 10, experienced discrimination. So what we also found in our survey is that smaller organisations were less likely to have policies in place to address each of these safety risks. But on the other hand, they were less likely to experience these negative events compared to larger organisations. And you can see that on this figure here, with the light blue bars being the small organisations of less than 20 people, and how frequently it was reported that they'd experienced those particular events. We found that workplaces scored higher on this domain if respondents reported their workplaces actually had a mental health or wellbeing or an occupational health and safety WHS policy. So it's great to see that actually having these policies in place actually improves the perception of mental health in the workplace. However, it is essential that these policies are actionable in real life and not just tick the box exercises. So I'd encourage you to ask yourself first if your workplace has zero tolerance approaches to these safety issues, and then how does that actually play out in real life? And once again, a couple of examples of how safety is addressed in different workplaces. And clearly there are workplaces that, based on the nature of the work that they do, they might have really quite advanced and developed approaches to ensuring safety within the workplace. But it is true that there are still the other circumstances where mental health might not be talked about, or there are policies and procedures, but there's no actions in place that really help people and help them to be safe at work. Leadership is a domain that persists from previous iterations of our survey. Now, whilst the 2022 data further underlines the importance of leadership for workplace mental health, it also points to the complexity of providing leadership in the modern workplace. So managers are required to support the mental health of their workers, but they also need to be seen to be walking the talk in terms of looking after their own mental health. As you can see from the responses here, there's a bit of a complex diagram, but the light blue and the green parts of the bars indicate the proportion of respondents who agree with the statements about how their managers operate in the workplace. And while it's good that top bar there, we can see that nearly 60% agree that managers demonstrate how they support their own mental health. That part that I've circled there, it's actually quite different to how workers actually perceive their managers doing the standard work support things, if you like. So workers are more likely to see how their managers are actually supporting them in doing their work tasks, but not necessarily demonstrating how they look after their own mental health. And so that tells us there is room for managers to demonstrate how they look after their own mental health and make sure they're not necessarily modelling that tired stereotype, if you like, that managers, they work harder. They have to spend more time doing things. That they actually need to be demonstrating that they take time for their mental health and they manage their own workload in a healthy manner. These two quotes show the different ways leadership can impact mental health in the workplace. But leadership is clearly much more than setting people up just to get the work done. Leaders need to be very aware of how they can influence the mental health of people within the workplace. How well trained and knowledgeable are the leaders in your workplace when it comes to mental health? And would they benefit from mental health focused training to improve their own skill set as well as the skill set to support others? I'll leave that there just for a moment longer in case you need to finish reading the quotes. Work design is a new domain in 2022, and it is focused on how specific tasks that make up a role are organised. It's focused on work-life balance, but in practice, and how workers can be empowered to control when or how they complete their job tasks. For some roles, adjusting work design is much more difficult than others. For example, we found that healthcare and education industries scored quite low on this domain, but that's not really surprising given there is often little flexibility in how these roles can be delivered, particularly given the environments in which they need to be delivered, thinking particularly of the hospital or a school environment. But we also identified that fewer women agreed that their workplace was flexible, both in when they're able to complete their work tasks and being able to contribute to decisions that affect their job when compared to men. And you can see that on this graph here. The proportion in blue is the proportion of men who agreed that their workplace supported, whether it's flexible work or control. And the women's bar appears in pink, and it's lower across each of these factors. And so what that means is when we're looking to improve mental health and work, it's really important to provide options to all workers, but particularly those who are likely to be juggling multiple work and family responsibilities. And we know that for the majority, it's females juggling a lot of the family responsibilities at the same time as work. Now, we know that remote work is a feature of current workplaces. And when we examined the proportion of time spent working from home, we found the amount of time working remotely didn't impact connectedness, and that's the blue bar on this graph. It was pretty similar across all the proportions of working from home, whether you're working completely remotely or completely at the workplace. And we think this is probably likely due to the technology that enables communication between teams working remotely, the technology we're using right now. However, we did find that the amount of time working from home did significantly impact the overall score, that is the other domains of a thriving workplace. So those working from home the least and those and the most, they scored the lowest overall scores. And with those working up to half of their time scoring the best overall. So indeed, what we can identify here is that in terms of mental health, the optimum amount of time working from home appears to be 1 or 2 days a week. If you go much more than that, it does have an impact on mental health. Once again, there are some examples of how flexible work can play out. We found a strong relationship between work design scores and individuals that show signs of positive engagement and good mental health in the workplace. For example, those who agreed they were satisfied with their job had a higher score of 77 compared to those who didn't, of 44. Intention to stay was also related. So with those who intend to stay within their workplace for the next 12 months, had a much higher score for work design, around 74, compared to those who didn't intend to stay, where it sat at about 50. And finally, people who strongly agreed with statements about having clear job descriptions and realistic deadlines scored on average twice as highly in almost every domain compared to those who strongly disagreed. So a focus on work design has several benefits beyond just mental health of workers, but also impacts the ability to keep people engaged at work. The final domain to work through is capability. In 2022, capability is focused on the real-world ability of a workplace to support mental health. It's moved beyond whether policies exist, and it's now focused on things like the ease of access to support services and how well workplaces can support efforts to enhance mental health. We found that full-time employees score the best on this domain, the average score there of 67.9, but independent contractors and freelancers and casual workers scored well below that overall average. So there's an urgent need to support workers who are in more precarious employment situations and those engaged in the gig economy with real-world access to environments that are supportive of mental health, and to provide supports that allow people in these situations to be able to access them readily without too many barriers in the way. And so here we have a couple of examples where capability is done well and done poorly, as described by the survey respondents. In fact, we found the youngest and the oldest, so the youngest being 18 to 29 and the oldest, the workers 55 and older, had lower than average scores for capability. And so did women when compared to men, and those working in physical compared to more mentally demanding jobs. And finally, those in the public sector had higher scores compared to those in the private sector. So these are just some of the factors that need to be considered when designing access to mental health supports in the workplace to enhance the capability of mental health supports. So there are lessons to be learned from different sectors within the workplace that can be applied elsewhere. So having covered off our domains and the information about the domains that we've captured in our latest survey, it makes sense to touch briefly on psychosocial hazards. So we collected information on more than 20 specific psychosocial hazards, but I'm only going to cover the top contenders in this space because I'm running out of time. But we also have specific data that actually addresses many key known risks. So if you have any specific areas that you want to know more about in terms of psychosocial hazards at your workplace, please contact us here at SuperFriend. We'd be delighted to share the knowledge that we have in your particular area of concern. So I'm not going to go through and define each of these psychosocial hazards. I'm assuming that the majority of the audience today is familiar with this list. Indeed, you see these words popping up in publications from Comcare, Safe Work Australia, multiple jurisdictions where we see these hazards being thrown around. And this list is ordered from the most poorly controlled hazard at the top to the better controlled, at least according to our survey, at the bottom. So inappropriate workload was the highest risk. And most frequently, respondents actually described that having too little work to do had a greater impact on them than having too much work to do. But there's also the importance of role clarity was underlined for us as well. We found that people who strongly agreed with statements about having a clear job description and realistic deadlines scored on average twice as high in almost every domain compared to those who strongly disagreed. So some of these risks are really quite important in terms of how mental health plays out in the workplace. No surprises there, given the legislation coming in to help workplaces support their workers to deal with them. Interestingly, when we asked people about whether they would like to spend more or less time working from home than they currently did, there was very little difference in the connectedness domain. So on this graph, you can see 3 lines. The blue line are people who said they wanted to work from home more than they currently do. The green line represents those who actually had the right balance. They were working the proportion that they would like. And then what colour is that? Kind of yellow coloured line or light green, depending on how well your screen displays it, are those who said they actually wanted to work from home less than they currently do. And to the very left of this graph, you can see the connectedness scores. They're all very similar. But those who wanted more and were already balanced, their scores actually declined. So what this tells us is that differences started to emerge for those who actually want to work from home less than they currently do. That is, they actually want to get back to the workplace more. They were actually currently scoring higher across the remaining domains than the other 2 groups. And so for those who do want to move back to spend more time in the workplace, there is considerable effort required to maintain their current feelings of safety, work design, and capability to support mental health as people move back to on-site work. There's a risk that people moving back into the workplace will correspond to an increased exposure to risks to mental health that were not there when they're working from home. It seems like the movement to bring people back into the workplace needs to correspond with a significant upskilling of the workplace to support mental health in real terms, particularly when it comes to capability, where the biggest discrepancy between the current scores lies. Now, finally, as I look over to my timer that I started late, I've got very little time left. Please keep me on track, Megan. I'd like to share with you the vision statements of the best possible mentally healthy workplace that people described. And we asked people for their blue sky vision of the most mentally healthy workplace possible. I'm going to stop talking for a short amount of time and allow you to read some of these quotes. But hopefully you can see from these some of the things that I've just talked through about the different elements and the different domains and how they actually play out in the words of people who responded to our survey. Apologies, I'm going to move on to the next one. I'm sure the presentation is being recorded and you might be able to hit the pause button if you wanted to go back to read them. I'm going to keep moving through. Megan gave me a nod, so Megan's read it, so that's important. Hopefully, as you're reading some of these too, you might identify some aspects that that exist or you would like to exist in your own workplace, or be thinking about some of the ways you might actually be able to implement them. This is the last one. Okay, I got a nod from Megan. So I just wanted to take a quick minute or two to describe how the information that we've collected and that I've presented fits in with existing research related to workplace mental health. So where does it fit in with what's known? And please keep in mind, this is a rapid approach. I'd love to discuss further how these findings can be integrated with the latest knowledge. Megan smiled, so she knows what I mean. You're the only face I can see, Megan, so I'm just going to play off your reactions. So firstly, our domains are clearly aligned with system-level approaches that have been described by several preeminent authors in the area. I mean, in particular, our domains fit really nicely into the integrated approach described by Tony Lamontagne and et al. I hope I pronounced his name correctly. In this model, there's a protective focus of the first thread of that model, and it aims to identify and address factors that can adversely affect mental health of employees. We've identified a range of those factors that can impact that mental health, and that therefore encourages employers to fulfil their responsibility to provide a safe and healthy working environment. And the overall goal of the second thread is to complement that risk reduction approach by promoting the positive aspects of work. And our domains of connectedness, safety, leadership, work design, and capability describe in detail different components of those two threads. The third thread really focuses on recognition, treatment, rehabilitation, and return to work of working people affected by mental disorders, which is really a next step beyond the indicators of a thriving workplace survey. And our aim with this survey is to really provide a lead indicator of workplace mental health across the whole of Australia. And so finally, on that point, we've gathered industry-wide information regarding a host of psychosocial hazards in the workplace, as described by various regulators and industry authorities. And we'll be able to continue to monitor how those psychosocial hazards play out in Australian workplaces in the future. Now, a summary in a minute, I promise. So I've been talking flat out for the last 30 minutes or so, but if I tried to drill it down into a single minute, first off, SuperFriend has conducted our widest ever survey of Australian workplaces. And we've got a huge breadth of information that's been collected. We have our 5 domains that really summarise that information into easily interpreted scores across connectedness, safety, leadership, work design, and capability to support mental health in the workplace, to identify where industries can sit in terms of those different factors. These domains have been updated compared to previous years. They reflect a survey approach to make sure we've captured the absolute latest information, but also allowing us to provide a focus on actionable insights. And while I feel like I've been talking flat chat the whole time, I've only scratched the surface of the information that we have to share. If you'd like to know more, or you want to see where your industry, you didn't see it in the slides, or you've got particular factors you want to know about, please get in touch, because if you want to support your people to thrive, please don't hesitate to contact SuperFriend. And finally, there's a necessary focus on meeting compliance requirements in light of new legislation, but we at SuperFriend are really strongly focused on helping workplaces to move beyond just compliance and to look to the best possible, to provide the best possible workplace for your employees so they can thrive both mentally and physically. And SuperFriend would love to play a part in your efforts to do so. So please get in touch. There are some contact details there, and we look forward to hearing from you.
Thank you. Thank you so much, Ross, for sharing that with us. And certainly it was fascinating to see some of the changes, I think, that have occurred over the development of the survey. And so that was really helpful. Just in terms of the Q&A, so we do have one question that's come through that you might be able to answer. And it relates to, I think it's a bit about methodology. So it talks around the scales within each domain of the are the scales within each domain leading indicators of mental injury? So I think it's talking about, I think it's specifically talking about the scales within each of those different domains that you indicated, the 5 of them.
I think that is an absolutely fantastic question. And unfortunately, the answer is, at the moment, we don't know. And the future steps for SuperFriend are to actually make the connections to be able to identify how well our domains do actually provide indicators of mental injury. That is, and when to qualify that, when I think of mental injury, I mean someone requiring time off work to recover. Perhaps they might make a claim, might need a claim because they're unable to work and therefore need income support or whatever it might be. That's ultimately where we would like to be in terms of being able to really clearly indicate when people are at significant risk of mental injury. We are in the process, we've started the process of actually connecting this data and the domains information to external information so that we can tell how well they indicate the likelihood of a mental injury or not. So it really, the answer is watch this space, because that is a clear aim for us at SuperFriend. So we can give people the confidence that when they actually apply these measurement tools within their workplace, that will actually give them a clear indicator of how well, not only how well are their employees performing, but to what extent are they at risk, and I guess the urgency of action, I suppose.
Yeah, that sounds really fascinating. Thanks. Thanks, Ross. There were a couple of questions that were put forward through the registration process, so it would be probably useful to talk through some of those now. And one of them talked about lead and lag indicators. And so the question is, what lead and lag indicators would you recommend as indicators of workplace mental health, and how regularly would you report on them?
It's an excellent question and a very practical question, particularly for a bunch of the audience whose, I guess, role it is to actually monitor those things. In terms of lead indicators, we have positioned, if you like, the indicators of a thriving workplace as a key lead indicator. But we still need to, like we mentioned before, we still need to really establish how strong a lead indicator they can be. Now, at present, we conduct the survey once per year, and that gives us, I guess, industry level information. In the not too distant future, there'll be an opportunity to apply an abbreviated version of the indicators of a thriving workplace survey within your own workplace to be able to identify what are your own lead and lag indicators within your workplace, and be able to identify that at a specific workplace level. In terms of how often to run them, that's part of what our testing will be in the future, to actually give best bang for your buck on that front, because we know people suffer a little bit of survey fatigue, particularly in the workplace, and the last thing you want to be doing is overburdening employees, particularly if you've identified that there might be some challenges to mental health within the workplace, to overburden them. So I can't give an answer from a SuperFriend perspective, but we will have an answer soon.
Fantastic. Thanks, Ross. I think this goes maybe a little bit to your actionable insights, which I really like the phrasing of that, because I think it's sort of provocative enough to get you interested, but also to sort of actually pick up something, and obviously to apply it in the workplace. But the question is, do you have any recommendations or suggestions around mental health activities that we should or could be doing as a team to improve and promote workplace positive cultures? So behaviours and things like that, I suspect, is what that's getting to.
Wow. I think what we're seeing from our data and the complexity in terms of some of the questions that we've asked, and certainly in a lot of the responses, is that those activities need to be genuine. There were multiple references in the comments to leaving a fruit basket in the break room as being an effort to improve mental health. And we know that, and what we clearly see is those token efforts aren't, they're seen for being token efforts rather than genuine attempts to improve mental health in the workplace. So within our connectedness domain, there was a lot of the responses are really related to how well employees trust each other and how well they get along. So rather than prescribe an activity, I think the opportunity for employees to actually identify with people that they're working with, and opportunities to trust them or build a shared understanding in terms of what it is that they're trying to achieve. We also found that that things like actually having a clear organisational goal and an organisational vision actually increased people's connectedness because they saw a common purpose at work. So sometimes, I guess what I'm getting at here from an actionable insight point of view is that a lot of the things that we know that workplaces tend to do, or organisations tend to do, in terms of setting strategy and providing organisational goals and describing values in the workplace, they actually have a lot of benefit in terms of even that connectedness component. So it doesn't necessarily have to be a trust exercise where everyone's closing their eyes and falling and hoping someone catches them at work. That build those things, and it's actually, I think, requires a willingness to examine your own workplace and the attitudes and the different things that are going on in the workplace. And sometimes you'll need a specific set of tools to do that, to identify where are the areas that we need to take the most action. At some workplaces, it might actually be really quite easy to identify what those might be, but at others, it will actually be more complex. So it's actually worth identifying from the range of tools available to help work out, well, what is going to be best for your workplace, because token efforts won't do it.
Yeah, thanks, Ross. That's a helpful discussion, I think, and it certainly aligns with what we hear as well, and obviously what comes through in the literature. There's another question. Someone who's obviously very well versed in SuperFriend's indicators of a thriving workplace, is asking around. Previously, the measure 80 was considered thriving, and they're asking whether whether you have an overall thriving score within these new domains.
Oh, what an excellent question, and one that we've talked about at length within SuperFriend. And one of the reasons for that is that our domain scores are actually quite a bit higher than what they have been in previous surveys. And the reason for that is simply we actually have a new set of questions that are informing our domains. So rather than actually use the old benchmark of 80 and actually potentially give people the impression that, hey, we're actually doing really quite well, but when we know on the ground that lots of people are struggling in this space. And rather than go, well, if our scores have gone up 10, so our previous marker was 80, let's make it 90. We actually want to take a much stronger evidence-based approach to actually defining what is that measure of a thriving workplace. At a minimum, it is actually performing well across each of the 5 domains. But, and I mentioned it earlier, we actually are looking to establish a connection with some of the external markers of mental health within the workplace. We are actually waiting until we have that external anchor before we actually want to provide a new score, because we absolutely want to give people a target to strive towards, but we want that target to be meaningful. And we feel like using the old target isn't that, and sort of any other approach without that level of evidence would actually be a token. And if we want to drive action, we need more than token targets.
Great, thanks, Ross. That's really interesting. I think you've really demonstrated the depth that goes that you've got in this survey just by your responses and things. So there's clearly a lot, really a lot that is there in terms of what the data is showing you, and also what you've presented today. And we really thank you for the efforts in the presentation. And I think there's a lot of follow-up that can occur on the back of this, because it's really pretty exciting. And so congratulations first and foremost, but also know that it's early days, but really hoping we can get you back to another community of practice to sort of keep building on what's coming out of this particular survey, but also, I guess, really focusing on that actionable insights piece. And I love that connectedness frame. I think it's really valuable and interesting, and really sort of resonated with me as well as when I was listening to your presentation. So thank you. We've just run out of time. We've done excellently with the time. We managed to get our questions in. So thank you so much, Ross. Really appreciate your presentation today. Thank you so much for joining us today. I'll leave the link up for a little while because I've given you 10 minutes back in your diary. So, just in terms of managing your work demands, you can hopefully get a cup of tea. But we'd also like you to do the survey first before doing that. But thank you so much and have a wonderful afternoon.